Hi, in this video, our topic will be discussing POI, or also known as Premature Ovarian Insufficiency. Another name is Primary Ovarian Insufficiency. Sometimes we also call this ovarian failure or ovarian fatigue. You understand why this is. So this condition is very distinct. It means that the ovaries no longer function normally before a certain age. It's happening prematurely. Younger women are experiencing this. And normally we will observe this in women who are slightly older, going towards menopause. These are some premenopausal symptoms. But these women are instead experiencing this in their 20s, in their 30s, affecting their pregnancies and also difficulty even conceiving. So, in definition, the ovaries no longer produce this estrogen and progesterone regularly, and they do not even produce them, sometimes not at all, or at very significantly low levels. So they don't even really cause any physiological changes. So symptoms for this condition is that you are regularly missing your periods, or your periods are very irregular. This is a very key symptom. Second symptom is that you have a decreased sex drive, and then you have an irritability, you have an increased annoyance from your surroundings. You also have some anxiety, some depression caused by this hormonal imbalance, the lack of this hormone in this case. And then you will also have difficulty in conceiving, so unexplained fertility for long periods of time could be POI. So POI can cause either infertility or recurrent miscarriage, depending on how severe it is. So let's talk about the infertility first. How does it cause infertility? Is that because your ovaries are already affected, the functions are altered, so it no longer produces these hormones. Furthermore, it's not even releasing any follicles. No egg cells are being released. That means you don't menstruate at all. So if there are no egg cells being released, the sperm can no longer fuse into a zygote. So these types of POI cause ovarian infertility. Secondly, let's talk about how POI causes recurrent miscarriage, which is the common one that we see. These types of patients have ovarian function but affected. For example, they still produce hormones but too low to be significant. They still release egg cells into the fallopian tube. However, either it can be very unstable that the egg cell disintegrates, or the egg cell can fuse with the sperm cell into a pregnancy, but is unable to implant on the endometrium for long term because of the low hormone production, low progesterone, low estrogen, which means the endometrium is not thickening at all. It's very thin. When endometrium is very thin, implantation is very shallow. So at most you can sustain these pregnancies for 2 to 3 weeks in line with miscarriage. And this happens repeatedly, causing recurrent miscarriage. So here at Antai Hospital, we diagnose this condition by first doing an ultrasound, by looking at the ovaries, and then we also need to do a blood test to identify are you really lacking these hormones. Our treatment, because we understand that this condition is caused by ovarian fatigue. Ovaries are actually no longer functioning normally because they are being fatigued due to previous chemical changes or medications that you have gone through. So our treatment is that we will give you medications which is mostly consist of contraceptives or birth control pills to actually halt the function of the ovaries for temporarily, let it recover over a period of 3 to 6 months. And after 6 months you come back to us, you will realize that your ovaries will start to regularly release these follicles because it has time to recover now over 6 months period. But this is what we look for. You will begin to menstruate regularly, and then your ovarian follicle qualities are also very high, able to sustain pregnancies to full term. To find out more information about this diagnosis and treatment, please visit our website. Also arrange a consultation with us today.